A new study shows just how much your weight could impact your ability to beat COVID-19. 11 Alive's Latasha Givens talked to doctors about the study and why weight is such a risk factor and how that could play a role in the vaccine rollout process.
New details about COVID-19 and obesity are causing concern and controversy. The CDC releasing the results of a small study this week showing out of the COVID patients hospitalized last year who needed ventilators and ultimately died, 28% were considered overweight and nearly 51% were obese. We turn to Kaiser obesity medicine specialist Dr. Marcus Christopher Griffith and Dr. Sujatha Reddy for insight.
For someone who is obese, how does their body function differently than someone of a normal weight?
So when you're overweight, your heart and your lungs are really already working harder. And then when you push them, you stress them, it really makes them work all that much harder.
Dr. Griffith says an obese person's immune system and respiratory system are already compromised, making it an uphill battle at first cough.
Obesity affects every single health condition: cardiovascular, diabetes, people with respiratory problems. And then when you can't move your chest wall muscles in and out, that's what sets people up to have to go on ventilators.
The CDC has long considered obesity a high risk factor, but here in Georgia, that alone doesn't make you eligible to get a vaccine right now. However, as of yesterday, parents of a child who is obese are able to get a shot, with DPH listing it among the serious medical conditions for kids.
Obesity may be a greater risk factor for death and complications compared to someone who has asthma, emphysema,